Hello, this is Ask DeFacto program. We're going to update you with current COVID-19 situation in Mongolia. According to the press conference held 2 hours ago by the Ministry of Health and the State Emergency Commission, Mongolia has now total 608 cases of coronaviruses, out of which 146 are domestically identified. Last night we had additional 26 cases, out of which in Ulaanbaatar city 2, and there are other 4 provinces. Seling province additional 19 last night, the largest amount, and Dornqabi Aimak 1, and Darhang Aimak 4, and altogether Ulaanbaatar made into 40. Seling cases came into 77, Dornqabi Aimak 17 cases, Darhang Aimak 20 cases, Orkhon 17, and Qovsumbur 1 cases. Last 2 have not identified last night any more cases. We should note that all these noted Aimaks and Ulaanbaatar city exist along with the railway from Russia to China across Mongolia, in particular in the northern border. Since the pre-border area in Russia, the COVID-19 is very much intensified for the last couple of weeks, and now it looks like it comes to Mongolia because 77 is identified in the Aimak, which is existing at the northern border of Mongolia. Seling Aimak 77 cases, which is a half of identified domestically cases in Mongolia. Altogether, since COVID-19, Mongolia identified 608 cases. The remaining was imported in a way by passengers coming by special mission plane to Mongolia for the last 10-11 months. So today, last night, some 1,300 people were additionally tested, and there are 6 labs working in around the country, in particular in those 6 provinces I have identified. So far, 800 persons are in isolation, and some 728 persons are under investigation. They keep testing them almost every day. And so testing capacity in the country is so far did some 41,000 tests in Mongolia. Based on the statistics out of tests, 56% of those identified are healed, and only 3% are in critical conditions. No death so far, thanks God. And we have 19% of all identified cases having preconditions, sicknesses, but 15% of those identified was feeling a dry cough, and they had lost sense of taste and smell. That's what especially warned by the Ministry of Health, so that people identify their COVID-19 cases, which is different than the other grips, or we call it coughs, usually happened at this time. So Mongolia is trying to, as much as for identify cases and isolate those who are sick. However, this decision is meeting a lot of resistance from the people, in particular from the businesses who are losing their businesses. And the people demand help or compensation from the government, which is spend a lot of money for mostly social part of the disease. They paid a lot, for example, children allowances. Each family has some money, but looks like the government has not any more room to extend more money to businesses. That's why yesterday they have a bit released at the time of lockdown, in increasing the food supply time by which was at night. Now it can do it during a day. Now public buses work still more extended time from from today. It was before from 6 to 10, 5 to 8 in the evening. Now the public transport is working daily, and only those people who need urgent help, they can go. And there are 16 services identified where the people, professionals can go freely, showing their identity, and which includes funeral cases, medical helps, and media, by the way, etc. And now this one is a little bit lessened. This regime is a little bit lessened. It shows that the government cannot supply all monies required by the private sector. We don't know how long it will go on, but this lockdown will go till the December 1st, 6 a.m., after which the Mongolia is a situation that they probably cannot and should not keep the lockdown furthermore. And plus, the Ministry of Health spokesperson says that Mongolia in general keeps under the control the dissemination of disease, in particular for the last 5 days when we had extended lockdown. They were able to identify those people who were possibly the source of disease. So this is so far our update, and we will do it tomorrow in 24 hours for you again. Thank you.